You're watching the Wellness Hour, news that makes you healthier. My first guest, he's been on the program before, and he says nobody should be wearing a loose-fitting denture. This is a special report show, like a documentary, because we're going to actually meet one of the patients that have been through the process. We're going to go to his ranch and interview the patient. And I think that you're going to like what he has to say. I've done a short interview with him, and so we're going to bring him on the show. With us we have, of course, Dr. Matt Larsen. Dr. Larsen, welcome to the program.
Well, thanks for having me back on.
Now, you've been doing dental implants for quite some time. Now, for people that don't know your practice, like who's the typical dental implant patient that you see?
Well, there's two different types of patients that we're typically treating with dental implants.
Okay.
The first group of patients are patients that have bad teeth. They've got loose teeth, they've got bad breath, bleeding gums, they're missing teeth. And when it's determined that these people need their teeth removed, we give them a full set of implants and teeth that are anchored to the implants so they can chew, they can eat, they have all those problems fixed. The other group are one of my favorite groups to work with.
Okay.
Are the people that have no teeth. They've been wearing dentures for however many years, and they've just kind of gotten used to when they go out to a restaurant, they look at the menu and say, okay, I can get the applesauce or I can get the cottage cheese or the oatmeal. They don't look for what they want on a menu. Those are the people that I love to target. Yes, because they've been doing this for years. And a lot of times they have done it so long they don't even realize it anymore. They don't realize that they don't look for foods that they like on a menu, or that when they go to their family reunion, they bring their own food because they have to have something that they can eat. These people, we bring them in, and it's really fun for me because a lot of these people have been told there's no answer and there's no solution. And dentistry has really kind of let them down. They're really frustrated. And to get them to come in and be able to sit down with them, and with some of the new technology we have and the new techniques we can do, we go through, we look at their bone, we give them a solution. And for those patients, they will walk in one day wearing dentures, and when they leave after the procedure, they have new teeth that don't come in and out. They can grab them and pull all they want. I had a guy that was sedated, and so he was just kind of coming out of the procedure, and he's like, Dr. Larsen, you left something in my mouth. And I was like, well, what's that? And he reaches in and grabs his teeth and starts pulling. I'm like, no, those are your new teeth. And I gave him a mirror and showed him, and he's like, those are amazing. Like, he was so happy. And that was immediately after the surgery. They went in one day, he went 30 years in a denture, and in one day, he went from denture to teeth that don't hurt, that aren't removable, and that he can smile and be proud of.
Now, you told me on another interview that I had with you that it's hard to get these denture wearers in because they don't go to the dentist anymore. They don't know their options oftentimes. They don't realize they could get a new set of teeth on top of implants. How old can you be to get this done? Like, what's your oldest patient?
Oldest patient was 95.
Why would a 95-year-old want to do this?
That's a good question. Let me tell you about him a little bit. He came in and we were having a consult, and I actually asked him the same thing. I was kind of like you. I was like, you're 95. And he said, you know what? He said, I realized, I was thinking the other day. He said, I got money. He said, I don't have a lot of family left around. He said, all my friends have passed away. He said, I thought, what do I miss the most? What do I wish that I could do the most? He said, I want to eat a cheeseburger. He said, I've had dentures for so many years. He says, all I remember is I used to love having a cheeseburger. I want to eat a cheeseburger. And that's what we did for him. And right after his surgery, he had a cheeseburger.
Nice.
Yeah, he was so excited. So the average age, it's hard to say. It's all ages of people. And when people tell me that they're too old for it, I always tell them about Ralph. Ralph was my 95-year-old guy, and I tell him, yeah, you're not too old. What you're going to say in 10 more years is you're going to say, gosh, I wish I'd have done it then.
So when a tough rancher comes in and says, Doc, and they're only 70 years old, I'm too old to get this done. That's not even close.
No,
to being too old.
No, but they say that all the time.
Do they really?
And that's what my response to that is. I'm always like, well, if you can tell me your expiration date, we will customize a plan just for you.
Is that right?
Yeah. Because if you're going to be around another 10 years, your mobility might suffer, your lifestyle's going to change a little bit. The last thing you want to worry about is your teeth.
Now you told me in the green room, you said that another change was what used to take you like 6 months or a year now can happen in like as little as 2 or 3 visits. And people that weren't able to do this are able to do it today. Can you elaborate or expand on that?
Oh yeah, the changes in technology, the changes in our abilities, with AI being introduced to dentistry and some of the softwares that we have, it's incredible how efficiently we can do things and how fast we can take people from no teeth to teeth. I think that's the one of the coolest things that happened. There's a lot of guys out there that still are doing like these things over a year, and people are going into dentures and they're getting bone grafts and letting it heal, and you're going to all these different doctors, and it really starts to get overwhelming. I've talked to patients that have come to my office for a consult that have had similar procedures done other places, and they had 25 appointments.
So how specifically has technology helped you?
It allows us to take scans of a patient, print teeth, all at the same time that everything else is going on.
So you make the teeth there in the office?
Yeah, the same day that we're working with the patients. And it allows everything to be more efficient and faster. It makes it so that now what used to take 2 or 3 appointments, we can combine into 1 appointment, which for us is extremely valuable. We have patients that drive 6 hours to come see us that come from other states. And so a lot of these patients have had to take days off of work and had to rearrange their schedules to come in and visit. I want to respect their time and value that so that they can spend as little time in my office as possible, even though I am a fun guy. Like, I'm sure they want to hang out with me. But
now, today, I said at the top of the show, it's going to be a different type of a program today. You asked me if you could have me interview one of your patients, because I'm somewhat skeptical. I always think, and we've talked about this, like you're exaggerating about the results. So you have a Matt Duff that we're going to interview in just a moment. What could you tell me about Matt Duff, and why was this so important for you to have him on this program?
The reason that I wanted Matt to come on the program and talk a little bit is because he's everybody out there. The experiences that he went through, the things that he had, there's so many people out there that are having these same like problems and these same experiences, and they just think, well, I'm not a good candidate for it, or my teeth aren't bad enough, or my teeth are too bad. And we hear all of those things, and that's where I just want to tell people, like forget about all that, get that out of your head. We treat real people every day, and I think that Matt is really a good example of just a guy that was struggling, and I'd like to kind of have him tell his story about going through the whole process and what changes it's made in his life, because I think people can relate to that. Me, I'm going to say it's great, but to have somebody else that's been through it that could give their honest opinion, I think is real valuable.
All right, we're going to go to Mr. Duff. Matt Duff, welcome to the program.
I appreciate you guys having me on the show.
Now, according to Dr. Larsen, you now have a brand new set of upper and lower teeth that don't come out, supported by dental implants. After going through the procedure, what's changed in your life since then?
Well, a lot of things, Randy, but the main thing is being able to eat the foods I want to eat without thinking twice about it. I would say would probably be one of the biggest benefits, aside from just overall quality of life.
Like specifically, what can you eat?
Steak. So I'm out here in Montana, and I live on a ranch and guide hunters. We have a lot of big groups that come into the lodge, and steak night is a huge night, whether it's steak or elk or any kind of wild game. But I hadn't been able to do that in years. Before I got my implants, I would find a way to maybe even cut part of a steak, but I'd find a way to kind of duck out and make a turkey sandwich or something, instead of actually being able to order a steak at a restaurant, and just not thinking about that, where I was so conscious. I mean, going to a nice steak place, I'd look for fish on the menu. And now that's just, a side thought. If I see the filet, I can eat whatever I want without thinking about it.
So how many years did you have bad teeth? And did you, at some level, like in the back of your mind, think you were going to end up in a denture?
Absolutely. I mean, those thoughts of my great-grandmother pulling out her teeth and setting them on the kitchen sink is kind of where I thought I was going. But then I started looking into it, and that's when all these implant places started popping up. As you know, algorithms these days with social media. So I was starting to get these marketing campaigns that were coming across my social media feeds. And so I started checking into it, realizing that implants were something that was a possibility for me.
That's everybody. That's one of the reasons that I wanted Matt to be on. That's everybody. Everybody struggles like that. Everybody has those things where they're hiding their smile. Or they just don't smile. We see that all the time, and they've got pain in their mouth. Their teeth are hurting. They can't chew. They all kind of go through this. These are the people that a lot of times don't realize they're suffering because they've been doing it for so long. They've gotten used to it, and they don't have to. We can fix that.
Now, you were at a big conference, you told me, where you were insecure about your teeth. Tell me about that.
Yeah, I feel like over the years I had gotten more and more conscious of how it looked, and seeing myself in the mirror, and I had learned how to hide my teeth, and really, my smile was teethless, and I had gotten so good at doing that. Now that the procedure has happened, a lot of friends, business associates, or whatever have noticed a difference, but a lot of them don't understand what the difference is, because everybody that goes through what I've been through and is conscious about your teeth, or you have issues, you learn how to hide it. And even talking to close friends now that I've had this procedure, they've opened up to me and go, shown me their smile and go, look at my teeth. And I'm like, I am telling you, this is the best investment I've made, not only to myself, but everybody around me, because they're affected as well, because your overall mental health and attitude starts when you get up in the morning and brush your teeth, or lack of teeth, looking in the mirror. And so now that I have these awesome indestructible implants, my thoughts don't even go to that anymore. And I would spend a lot of time being self-conscious about everything I did in life because of my smile.
So you really couldn't eat, like a steak was out of the question.
We've got a local place right down the road from the ranch called On the Rocks in Warden, Montana, and owners have become good friends, and they're known for their cuts, and they're all local beef, and I've never been able to order a steak there. So after I got my new lease on life from Dr. Larsen, and he said, hey, you're good to go and eat anything on the menu, that's where we went. And I was able to order their ribeye and with all the fixings, and it was a great night, because that was one of my favorite foods. But I had neglected it for so long and hadn't been able to eat steak. It would take me so long to finish it. And so I just wouldn't order it. When I would go out places publicly, I'd look for something based on what I felt like I could digest. And that's no longer the case.
So now that it's all done, what do you like more? How it looks or what you can eat?
Man, it's a combination of what you just said, Randy. It's all of those things, but I would probably, if I really had, to be honest with, and I had to pick one thing, it would be the way it looks. And that's a personal thing from a self-confidence, self-esteem, mental health standpoint, being able to like how it looks. And I used to have really good teeth. I neglected them obviously over the years, and kicked myself for doing that. But getting back to where I used to be earlier in my baseball career, looking back at photos and things like that.
Was this affecting your career? Because I guess you were on TV. Before that, you were a pro baseball player.
Yeah, so, I out of college, I got drafted to play professionally by the Pittsburgh Pirates, eventually ended up making it to the big leagues with the St. Louis Cardinals. And then, unfortunately, career was cut a little short with Tommy John surgery. After that, through my baseball connections, we started a hunting TV show, an outdoor TV show. So, of course, now you're on camera even more, really, than you were on the baseball field, where the camera is up close and personal, sitting in a deer stand or chasing upland birds or whatever it is. Now I'm trying to entertain people who tune in to watch hunting shows or whatever. And so your face is up front and foremost on the camera. And that really became an issue for me, especially with the advent of social media now, where my marketing guys needed me to just turn the phone on myself and get whatever I was doing during the day. And I couldn't stand doing that because I would look at the video back and go, man, my teeth look terrible. And it kept me from really doing what I needed to do to kind of stay relevant with the hunting show with all this new social media and having to make regular posts weekly. I just was unhappy with the way my smile was and my teeth looked.
You know, Dr. Larsen has told me more than once that when people get new teeth with implants, they have to learn to smile all over again.
Absolutely.
Did you experience that?
Absolutely. That is spot on. You learn how to
made you look younger,
cup your lips over your teeth, and just when you do smile, or somebody you're in a group setting or whatever the case may be, and somebody says something funny, you're very conscious of how you respond to that. Absolutely. And then there's a lot of, when you just mentioned putting your hand over your face, that's kind of my go-to when I was filming for the hunting show, was to do something with my hands that sort of diverted the attention from my face.
It seems painful, this process.
Absolutely not. You don't even remember that, going in for your surgery on the day of surgery when they're going to do the procedure, and you wake up and you have your temporaries in initially and your smile is there, and there's really no recollection of the procedure at all. You're feeling pretty good after surgery, actually. And then there's a couple of days of, I would say, some discomfort, but it pales into comparison of what I was dealing with when I went in for the procedure, because my teeth were hurting, what little teeth I did have, and to wake up with a full set of teeth and not even remember, that was just, completely, there might have been a little skepticism going in, going, how bad is this going to hurt? But that was a non-issue. Absolutely non-issue.
Randy, it's true. People are always worried about that, but what ends up happening, it's not as bad as they thought.
Did they confide in you and say, Doc, I was so worried about this
all the time
for nothing?
All the time. They get so worked up about it, and then afterwards they're like, that was easier than the last time I had a dental procedure done.
So everybody's numbed up, they're sedated, and as he said, you literally wake up to a new smile?
Yeah.
That's
absolutely.
Not an overstatement?
Absolutely.
Yeah, no,
it's not full sedation. It is a partial sedation, but you don't remember. You're still conscious to be able to actually respond to Dr. Larsen and his team if need be, but I really have no recollection of it as far as, feeling anything that would cause any discomfort. It's just non-existent.
What was it like when you saw your teeth for the first time in the mirror?
When I first got out of surgery, really just seeing it in the mirror, once I was out of sedation, was a pretty emotional event for me, just seeing what it looked like. And, if any type of skepticism would have been there, it would have been more about how they were going to look, because I had gone so many years with not showing my teeth. And in fact, going through that process, when I smiled for the first time and saw my teeth, it was pretty emotional in a good way, to see that now I could smile again, and I was kind of back to who I used to be from the way I used to look at myself in the mirror, and that was a great thing.
You said your wife made the appointment for you. I'm guessing she was probably tired of hearing you complain about it. But what did she say when it was all done? What was her response?
She had not, seen me really when I had a full set of teeth. We had met, and I was kind of at the beginning of going through my issues with my teeth and not having these back molars. So all she's ever known me was somewhat of a moody, grumpy guy for the most part, that had learned how to hide my teeth. And so it was almost like a facelift. I mean, with the muscles in my face now being rejuvenated. And I just had a comment not too long ago from my college baseball coach who I hadn't seen in years, had been out in Bakersfield, California for years, just retired. They came out to the ranch and he's like, man, you hadn't aged a bit. You look just like you did in college. And I think that has everything to do with the teeth and the smile and, looking like I did in essence, because my muscles had sagged so much because I was so used to keeping my lips over my teeth. And now that's different. I mean, even when I'm at rest, I feel like you can see my teeth when I'm not trying to smile or anything like that. And just looking at photos now, it's just night and day different.
Randy, we get this all the time. We have the patients come in and they're super excited about the smile, but because they're being sedated, they have to have somebody give them a ride home. So they always have a family member or a friend or a loved one that's waiting to take them home. And it's so fun when we bring the patient out after the procedure, the first thing that the family member wants to do is, let me see your teeth. And they get so excited. They sometimes get emotional right there in the lobby and they didn't even have anything done. It's pretty exciting.
We only have about a minute left, but you met Dr. Larsen for the first time. How soon into that consult did you know this is the person? This is the right guy to do this?
It literally within the first 30 seconds of him sitting down and I'm sitting in the chair and him kind of looking into my teeth and just talking about, what my options might be. And when he said, hey, we can do this, we can do that. And just the sense of calmness he had and to go, hey, this is a solution we have right here at Yellowstone Family Dental. We do the implants right upstairs. We can craft them. You need this. We can make you feel so much better. That really affected me because I really truly felt from him that he's like, man, this guy's been dealing with this and man, we can really, really help. And knowing now how confident he was after seeing my teeth and the shape they're in, that really came across in the first minute of just talking to him in my consultation. It made me so at ease, and even this whole team at the clinic, I'm like, let's go forward with this.
Did you go in with like low expectations, like doubtful, like this is just going to be another dental office that tells me there's nothing that can be done?
Yes, I would say so. I had looked into other options, just, these teeth in a day type places that market. And then after hearing Dr. Larsen basically say what they are capable of doing within his facility and how they go about it and the process before you get to your final set, I walked out of there feeling great about the process. And I said, we're going to figure out how to make this happen from a financial standpoint or whatever. But I was on go from the time we walked out of his office to get the procedure done.
Do you have friends with bad teeth that were similar to your situation where you tell them about the procedure? And if so, what do you say to them?
So they've noticed. I have, a couple of friends that have seen me and I've been able to give my testimony, so to speak, with what I've been through, and they're going through the same thing. And I was able to speak on experience with Dr. Larsen and his team and have convinced them along with their wives to say, hey, make this a priority in your life. Don't put it off anymore like I did, because you're not going to get any younger and you can't get those days back. So the sooner you do it, the sooner you're going to have the benefits that I've been enjoying, and the quality of life for me and my wife and those that I interact with has been incredible. And putting it off is just going to prolong that. So I would, I've told them to go get it done.
So you do this all the time when it comes up?
And a couple of instances, I mean, with the two friends in mind that I have, I didn't really realize how bad they were dealing with it. And it was the same thing with me. I'm like, dude, I didn't realize, that you were dealing with that. But then they showed me, and because of me being forthcoming with my procedure and just, putting all this out in the open, a lot of people say, why would you do this? And, tell your story and talk about how bad your teeth were. But it's something I feel like so many, especially guys, deal with, and they're too proud or too embarrassed maybe to go into an office and just see what can be done because they're embarrassed about how their teeth look. That's how I was. And Dr. Larsen, in 30 seconds, maybe just forget about that. And now let's look at a way to fix this and get kind of your life back. So that's really my story with my friends or anybody that's watching is don't prolong it, make it work, figure out, financially how you can make it work. And it's just like we all finance things, whether it's a vehicle or a mortgage or things like that. This is an investment in you and the people closest to you that when you wake up in the morning, that's number one. If you're not feeling good about yourself, it's going to affect your mood, which is going to affect everything in your life.
Matt Duff, thank you for coming on the program and sharing your story.
Oh, it was my pleasure, Randy. I appreciate you guys having me on the show.
Randy, when I hear his story, that's everybody. That's every patient that walks in the door. They've all had pain. They've all, been discouraged. They've all had bad experiences at the dentist. And those are the people that I want to talk to me. They're the people that I want to say, listen, none of that matters. Like, let's start where you're at.
Okay.
And that's one of the reasons that I keep coming to your show is that I gotta find a way to reach those people.
To get the word out.
Yeah, a lot of them don't go to the dentist. They've had bad experiences. They've been disappointed. They've been let down, and they just don't go anymore. They've given up. And I want to be able to reach those people and let them know that there's hope. That we can fix that. Not only can we fix it, but we can fix it in a few appointments.
They tell you all the time. You told me that they say, Doc, you've changed my life. Do you feel like you changed their life?
I don't change their life. I have a small role that I play in this, but they changed their life. You know what? They made the decision to call.
Okay.
That's really hard. When you've been let down and disappointed at the dentist a lot of times, it's really hard to pick up that phone and come in. They did that. Then, after we get done, they're the ones that smile. They go out and increase their social awareness. They can go to restaurants, eat whatever they want. They spend more time with their friends. They smile more. They change their life. I get to play a little bit of a role in that, but I get to enjoy that. And that's over the years to be able to enjoy that with so many people. It's so rewarding for me.
So if somebody's watching this and they want to make an appointment, do they just call your office or go online and make an appointment?
They could do either.
Okay.
But the key to that is just make the appointment. We will sit down and we just talk. We just talk. Let's figure out where you're at, and then we can talk about where we can go from there.
Dr. Larsen, always a pleasure to have you on the program.
Thanks for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.